Good morning, everyone. Can we have the slide? Yes, thank you. So good morning, everyone. Today, as incoming president, I have the very, very serious task of introducing someone who once told me, completely seriously, I swear, that she had rather do a 12-hour video thoracotomy than give up a public speech. So, here I am, in front of you, doing the easy part, talking about her while she can't interrupt me. So, dear colleagues, dear friends, it's a true pleasure, a great honor, to introduce the 31st president of the European Society of Thoracic Surgeons, Professor Nuria Novoa. Nuria was born in Madrid on January 5th of an undisclosed year. Very clever. She knew from the beginning how to keep surgeons and statisticians guessing. Oh. Excuse me. She's married to Victor, and she has two wonderful children. Her son, Carlos, who is a radiologist. You can see, yes, he's there. I've been told that he reads CT scans faster than most of us read WhatsApp messages. Alba, currently mastering neuroscience, most probably to understand what goes on in the minds of thoracic surgeons. Now, behind every great surgeon, there is usually a great story. And in Nuria's case, our family helped found the famous Spanish cookie brand Wheezy. Yes, cookies. And the name Wheezy actually comes from her smile as a child. So, next time you enjoy one of those cookies, remember, you are testing the sweet, the inner sweet legacy of our ESTS president. Nuria's professional journey is highly remarkable. Medical degree in 1989. Specialized in thoracic surgery in 1995. And importantly, she was at that time only the 5th female thoracic surgeon in Spain. After working as a junior consultant, she finally settled in Salamanca, where she built most of her career at the university hospital. She was appointed associate professor in 2005, and then full professor in 2018. But the call of Madrid was strong, and in 2023, she returned back to the city where it all began. Today, she serves as Chief of Thoracic Surgery at Puerta de Hierro University Hospital. She's obviously a master of open, video-assisted, and robotic surgery, and regularly performs all three. We all have mentors. Nuria became one. But, she is probably one of the few people I know in the current ESTS board who can say with complete honesty, I have always been a serious professional. Yes, that's true. There's even photographic evidence. She earned her PhD, cum laude, for a pioneering study on AI in predicting pulmonary resection risk. It was, at that time, far ahead. She has been deeply, deeply committed to education, over 1,600 hours of teaching. She led 9 postgraduate and 21 research-granted projects. She used to be the coordinator of simulation training at the Medical University. She has published more than 160 papers, impact factor papers. Some of us struggle to publish more than, to publish one, and Nuria publishes more than most of our people post on Instagram. She has a personal H-index of 22 according to Web of Science. In the academic world, that's something. I would say that that's like having a surgical stapler that never misfires. She has received multiple awards, including in 2024 being named as one of the top doctors in Spain. And also, in 2025, she was honored with a Women's Leadership Award in Healthcare. In short, she is not just doing the work, she is getting recognized for it. Since 2013, Nuria has been a driving force behind thoracic surgical education in Europe. She became an ESTS counselor, we say counselor at that time, in 2017, and finally was appointed Director of Education in 2021. In that role, she notably led the Robotic Surgery Academy, the ESTS, Women in Thoracic Surgery Academy. And now, as president, she has just not made history, as you see, and that alone deserved a standing ovation. She has also made the ESTS board meetings start and finish on time. Yes, that's true. On this slide, you can see our dedication to ESTS. That's obvious. To be sure, on the left-hand side, at the bottom, you can see her. To be sure not to miss a session. She once slept in the meeting room. No better way to be literally in the front row at the beginning of the session. Now, whether that story is true or not, I will leave that to your own imagination. And here she is again, playing a central role in the Women in Thoracic Surgery Academy, an initiative that continues to open doors and break ceilings. Now. When you Google Nuria Novoa, as I was preparing this speech, I Googled Nuria Novoa. That's true, for some inspiration, and this is what came up. I thought, whoa. That's how she stays in shape for an 8-hour surgery. Just to clarify, this is not our ESTS president. This real Nuria Novoa might break a sweat on Instagram, but our Nuria breaks boundaries in thoracic surgery. This is our Nuria, the one who may not pose for fitness magazines, but inspires an entire generation of thoracic surgeons instead. As a Capricorn, Nuria is persistent, hardworking, loyal, deal maker, and practical. Exactly the kind of person you want leading a surgical unit, or at least organizing a conference when the coffee machine breaks. Just look at her, deep in discussion, lobbying, negotiating hard, even during the coffee break. Capricorns, importantly, are represented by the sea goat, half mountain goat, half fish, because they are nearly impossible to label and they defy categorization. They are born to climb and to swim, and that fits Nuria perfectly. You will see now what I mean. Yes, she catches fish, and she sails as well. She also loves the mountain. She's obviously gifted for climbing, mountain, and skiing. She has even been spotted wearing the same headlamp for both rock climbing and thoracotomies. That comes from the department. I want to tell you a secret now. I suspect she chose thoracic surgery because it was the only thing more difficult than her hobbies. And when she is playing golf, that's obvious, the same Capricorn focus is visible from the green to the OR. Capricorn women are known also for being relentless and determined, even in male-dominated spaces. You will recognize some of them. Capricorn women and Nuria push forward, quietly, steadily, unstoppably, even when surrounded by alpha males. And yet, she always smiles. That smile that once inspired a cookie brand now inspires a generation of young surgeons. So, today, we are not just welcoming the ESTS president. We are celebrating a friend, a pioneer, a teacher, a mother, and a true leader. She represents what we all strive to be: technically excellent, academically brilliant, and human above all. So, ladies and gentlemen, it is my sincere pleasure, my genuine privilege, and, let's be honest, my smartest professional move this year to introduce the presidential address of our ESTS president, Professor Nuria Novoa.
Well, thank you very much, Dr. Falcos. It's been really amazing. I'm speechless. That's all I can say. Well, anyway, let's see if I can return to normality. Well, thank you very much to all of you. And, well, that's me. It's my honor and my pleasure to start talking to you and present you something I've been thinking about since a long time ago, especially because I'm really, let's see if we can make it. Now it's coming. Well, I thought about this aspect of education when I was talking to some of my students, and you will see why. As I said, good morning, everybody, dear colleagues, dear guests, dear friends. I would like to begin today by expressing my warm, what an honor and privilege is to stand before you at this annual meeting of the European Society of Thoracic Surgeons. I would like to take a moment to thank each one of you for being here today. Your presence is proof of your commitment to advancing practice of our thoracic surgery and our learning, and to sharing our own experiences and insights. I'm incredibly grateful for the opportunity to share my thoughts with you on a topic that, as I was saying, I believe is important for the future of medicine and also for the continued growth of our specialty. It is related to education, as you have seen, one of the main topics of my professional lives. Following Kirill Korsakov's words, life never stops teaching. And I want to thank all who had accompanied me along my life, because without their interaction, I would not be the person I am today, and probably I would not be here, despite all the things that Dr. Facons has said about Capricorn females. It's easy to understand that those 27 years in Salamanca were key in all aspects to me, but especially in the professional one. I arrived for a short stay, and I finally be there half of my life. I'm grateful to all because we were not only peers, but friends. We created a great team, we learned to work in respect, and we achieved amazing goals. Above all, I'm grateful especially to Gonzalo Varela, who I named honorary member yesterday, Marcelo Jimenez, José Luis Alanda, Paolo Macri, Teresa Gómez, María Rodríguez, Marta Fuentes, Israel Rodríguez, and Clara Forcada for walking the path with me. And of course, I want to thank my new team in Madrid, because in such a short time, they have also taught me so many things. And we are developing a new path together that I hope it let us go very far away. And of course, my peers and friends at the ESTS. It has been an amazing trip, full of projects and hard work, always developed in the familiar atmosphere that characterizes ESTS. I have to recognize I've learned, enjoyed, and evolved a lot. At this point, I want to have a special thought and a special, and to send them a special hug to Dr. Ruffini and his family. As Dr. Varela mentioned yesterday, they are going through a very, very hard moments. So I want them to know that our heart is with you and with all your family. But if I had to say a big thank you, this is to my family. My son Carlos, that you already see, he is a radiologist, but also a great photographer and a sports lover. My daughter Alba, a promising psychologist and a neuroscientist, because both of them have taught me the most important things of life. Their love and support and patience made a huge part of my happiness and a great part of my success. And now, with a larger family, I expect life to be even better and much more exciting, let's say. When I first confronted what to speak about today, I wasn't quite sure what my focus should be. I knew I wanted to talk about education, but there are so many aspects about it that it was difficult to find something that was specific. It wasn't until recently, a recent conversation with my students, that I realized what I wanted to speak about. I remember this patient many years ago, a lung cancer patient that required not just medical expertise, but patience and a clear communication. Our conversations were long and sometimes difficult, but they were crucial. That experience reminded me that medicine is not only about what we know, but how we pass that knowledge to our patients and to our students and trainees. And that is why today I want to focus on something that I believe is essential for the future of medicine and that we need to promote. This is the professionalization of teaching, the pedagogical preparation of teachers of higher medical education. This is a concept that, despite its importance, does not always receive the attention it deserves. We talk frequently about innovation in medical technology, breakthroughs in treatment, protocols, and advancements in patient care. But how often do we truly reflect on the way we teach? How often do we examine the structure, the methods, and the intentionality behind the education of the next generation of thoracic surgeons? If we are to continue moving forward, we must not only innovate in the operating room and in the clinic, but also in the classroom. understanding classroom as any place where we have the opportunity to gather, discuss, teach, and learn. It is time that we promote teaching to the same level of professionalism and excellence that we expect in every other aspect of our medical practice. Modern medicine, at least in part, is the contemporary embodiment of the ancient art of healing, present since the earliest days of civilization. Today's physicians are the natural successors of the old-time healers and are expected to function competently as both healers and professionals. There was a time when the practice of medicine and the ways of teaching it were far simpler than what we have today. Back then, learning medicine passed down from master to apprentice, from teacher to student, often in the halls of hospitals or in the quiet intimacy of a clinic room. It was a tradition where knowledge flowed naturally, almost unspoken, grounded in observation and practice. But as medicine has grown in complexity, so too has the need for more structure and intentional teaching. We can no longer rely solely on the watch and learn philosophy that carries us through past times. The growth of medical knowledge, the rapid advancement of technologies, the nature of patient care have made it clear that we must evolve beyond mere observation. The challenges of today's healthcare systems are unlike anything seen before, and they demand a new type of medical education, one that is intentional. We need to have a purpose for everything we teach, professionalized, and rigorously developed to meet the needs of both learners and the patients it serves. Some research on the field reveals this concern is not new. It was at the end of the last century, but especially in the first decade of this century, when a lot of research was developed in this topic. There are some foundational principles that encompasses core values and behaviors crucial to the viability of the professionalization of teaching, such as learning engagement. I refer here as the ability to connect with and intellectually engage an individual learner of group of learners. Another aspect is the learner-centeredness, which is the philosophy of putting the learner first, assessing his or her needs, understanding her or his barriers to learning or practice, and tailoring the education program to meet its needs. Also, it refers to adaptability, the need to change programs, teaching modalities, priorities, and content over time to respond to learners, the practice, teaching environment, or even the teaching encounter. Also, it needs self-reflection, a large amount of self-reflection that signifies the ability of educators to think critically about their educational encounters and their efficacy and efficiency to improve. Without those principles, teaching will exist, but it won't be as satisfactory as it should. And which competences characterizes a surgeon teacher? Those are listed here. As you can see, it's based in a large reflection, all of them. But ideas and needs to fulfill are not simple. As we can see here in the table, and depending on what level of the surgeon teacher is involved, he or she would need to acquire further competencies or not. Maybe it's just the way we are doing now. In the clinical settings, our teaching field, for most of us, we need to remember that the formation of a surgeon should be seamless across the continuum of education, training, and practice. It has to be based on a strong commitment to supervision that balances patient safety. Remember the session we had yesterday at the nightmare session, with the professional development of learners. The professionalization of medical teaching is not just an aspiration, it is a necessity. If we are to prepare the next generation of surgeons to meet the ever-increasing demands of patient care with competency and innovation. Teaching medicine is not just about transferring knowledge. It's about fostering innovation and encouraging clinical thinking, and it must have a purpose. How often do we truly reflect on the importance of innovation in our teaching methods? When was the last time we questioned the effectiveness on how we communicate complex medical concepts? Innovation in medical education is not a luxury, it's a necessity, as I have remarked previously. If we are to keep pace with the rapid advancement in medical technology, the development of new treatment protocols, and the growing understanding of human biology, our teaching methods must evolve in parallel. But that evolution in teaching can only happen if we invest intentionally in it, or if we start using specific tools like AI to help us in the different areas of education. It is not enough to teach what a disease is. We must teach how I think about it, how to diagnose with modern tools, how to communicate that knowledge effectively to both colleagues and patients. For instance, let me remember the very recent discovery, let's say, that of the different evolutions of diseases, symptoms, and signals between males and females. This is something we were not aware of very short time ago. All this requires a structure, a framework built on evidence-based teaching strategies that can adapt to the rapid changes in medical science and skills in communication. This is equally vital. I often ask my students, how do you know that what you are saying is being understood? It is a very simple question, but one that often catches them off guard. Think about it. How many of you ask the patient what did he or she understand of the disease, the process, the procedure before signing the informed consent? Think about it. The ability to transmit complex medical information clearly, accurately, and empathetically is not just a skill. It's a fundamental part of the medical practice. Communication is not just an accessory to medical practice. It's its very backbone. And like any clinical ability, it must be developed and mastered. How do we often actually train for this? It's true that we talk to the patients every day, but are we really training? Shouldn't communication be as central to the curriculum as anatomy or physiology? It is, after all, the bridge between knowledge and practice, between diagnosis and understanding. We must invest in a structured communication training, patient simulations, reflective exercises to enable our students and trainees not just to understand medicine, but to articulate it effectively to those who depend on it most. However, in this evolution, there is a figure that is key and cannot disappear: the mentor. His role in medicine cannot be overstated, because mentors are the carriers of tradition and the gatekeepers of innovation. They possess vast knowledge that extends beyond textbooks and clinical manuals, knowledge that is rooted in experience, in real patient interactions, in the understanding of medical practice. More importantly, our true mentors know how to reflect on that knowledge and transmit it to the next generation. They are professional teachers without previous training. Through their reflections, mentors do not just teach what they know. They teach how to think, how to adapt, and how to face the unpredictable nature of medicine with confidence and competence. How far too often those who take on the role of education in medicine and are experts in the field lack the necessary tools to professionalize the act of teaching itself? Medicine is a science, but teaching is an art. and that requires training, development, and intentional design. When educators are not equipped with methodologies and resources to teach effectively, it hinders innovation. There is no room for creative thinking, no encouragement for students or trainees to challenge the status quo, and no platform for pushing the boundaries of medical knowledge. To cultivate these qualities, we need professionals who not only understand medicine, but understand how to teach in a way that challenges students and trainees to think beyond the textbook, to question, to innovate. To truly put learning into practice, we need to focus on hands-on experience, on practical applications, not just theory. There is an old saying that many of you are familiar with, I'm sure. Tell me and I forget. Teach me and I may remember. Involve me and I learn. This simple truth is at the heart of effective medical education. This is why simulation-based learning, interactive case studies, and structured clinical rotations are not just optional additions, they are essential components of medical education. We know simulation is key to robotic training. You cannot start operating in a robot without an initial training and without obtaining a certain scoring level as a surrogate of expertise. But this should be equally important for all the areas of our thoracic field. Remember that yesterday we presented the results of a survey in which no one of the seniors and not so seniors were trained for open surgery. They were trained in the patient, and this is important. We cannot expect our students to master surgical techniques simply by reading about them or by observation. They must experience it, make decisions, learn from mistakes in controlled environments. This is crucial, and build confidence through repetition. Imagine a world where every trainee enters the operating room for the first time, not with anxiety, but with confidence, because they have practiced it over and over again in a safe simulator environment. This is how we turn knowledge into skills and skills into expertise. And this is how we must think if we are truly transforming medical education. This brings us to an essential question. How do we truly professionalize teaching in our field? This is perhaps the most critical question of all. How do we ensure that our educators are not just experts in the field, but also experts in teaching? It starts with identifying and empowering those who excel in communication. After all, if knowledge cannot be effectively communicated, it is of little use. Moreover, we need professionals who understand curriculum development, not just as an administrative task, but as a critical component of medical education. We need educators who can assess what is most crucial in each field and who can structure learning experiences that are logical, engaging, and deeply impactful. We need to help trainees to focus, to learn with a specific purpose. Designing an exam is not merely a matter of asking questions. It's a deliberate exercise in measuring understanding, promoting deep reflection, and inspiring further learning. It is about challenging our students and trainees to think critically, to apply their knowledge, and to engage with material in a way that is meaningful and enduring. A well-structured curriculum does not educate, but it transforms. So, in conclusion, I urge all of us to reflect on how we teach, not just what we teach. The future of medicine depends not only on groundbreaking research and innovative treatments, but also on how effectively we pass that knowledge to the next generation. We must professionalize teaching in medicine, not as an afterthought, but as a core element of medical training. Let us build a future where every doctor is not only a healer, but also an educator of the highest standard. Together, I truly believe we can elevate the way we teach, the way we learn, and ultimately, the way we heal. And remember, teaching and learning is a never-ending story. We are all teachers and we are all trainees. Thank you very much.